Before I took this class, I was really picky. Asparagus, I thought it was just gross and slimy. But now it's like, if it's made a certain way, it's really good.
Here, we've tried different things, and that's one thing that he would never do before.
What you doing now, Mama?
We're both overweight, so I just wanted to get us on a healthier lifestyle, including our food, not just exercise. Become a healthier, whole family, because being unhealthy is not being happy.
One of the most innovative programs is something called Healthy Families, Happy Families. They come together on a monthly basis. It works to help children and their families learn skills around weight management, healthy eating, and exercise.
There's no other medical condition that affects more children than childhood overweight and obesity, where we see about a third of our kids affected. And here with our center, we're really focused on empowering families, but also working with communities so they both can become more healthy.
The 1115 waiver allowed us to greatly expand the services for the Family and Child Obesity Project. There's really no way that one single specialty clinic or one group here at the hospital can do it all.
We're here to work with kids and their families to really change their family history. And where that change needs to really start is with the kids.
I knew that my grandma had diabetes. I didn't think it was really anything. I thought it was just, something like that she had.
I just remember him being so shocked by the different facts that he learned in school. And so even though he doesn't know it at the time, but he was ready for different changes also.
It was kind of concerning to me. I've seen what it's done to her, and I don't want the same thing to happen to me. So.
Working with kids is really the time that we can invest less money and achieve far more. Yet, childhood obesity is a health condition that's automatically rejected by the majority of health insurance plans in Texas. They can't actually see a doctor for obesity until they have a consequence of obesity: high cholesterol, high blood pressure, depression, bone and joint problems, and that's far too late. We are wasting huge amounts of dollars addressing these problems rather than preventing them on the front side.
I wanted to make sure that I could teach Alessandro how to make healthier choices so that we don't end up like my parents. You know, if we start young, especially for him that he's, still a teen, then it just becomes a lifestyle versus, it's second nature. You don't have to think about it. You just do it because that's what you know.
The money we spend now will be preventing a lot of long-term comorbid disease among these children, which will be very expensive for all of us if we don't do something about it ahead of time.
Without the 1115 waiver program, we would not have been able to build out our center. We had been operating basically on a shoestring for a number of years, starting to demonstrate some meaningful impact, but this has really allowed us to scale up and really come head on with the epidemic of childhood obesity that we're facing.
I don't want him to go through what I've had to go through with my mom. And I don't want him to have to go through that with me.
We definitely have to make this.
Very good. It's a burden on everybody, not just the person with the issue. I hope that it offers him just a healthy life.